Welcome back, everybody. We're coming back to you now we have another presentation that was starting here at 11:10, 11:11. We wanted to welcome Kristi here with us today. She's Vice President of Managed Services, EHR Managed Services, I apologize. And she's going to talk to us today a little bit around automation and assessing that and what it looks like in the capacity planning world. So without further ado, Kristi, I'll turn it over to you, and we look forward to hearing your presentation.
Thank you so much, Clay. Hi, everyone. Good morning. First of all, I want to apologize. I'm coming to you from the Chime conference in sunny San Diego, so apologize for the background. But I am thankful for the paradigm shift that makes this possible. So now that I've made you all angry, because I know what Northeast Ohio is right now and the temperature, I'm just going to dive into the presentation. So today I'm going to talk about assessing for automation in capacity planning. I'll do a quick little introduction. So my name is Kristi Lanciotti. I spent about 15 years in healthcare, the first 10 in IT and operations, in and out of different large healthcare systems, clinical operations, IT operations, specifically clinical EHRs, and really passionate about advancing healthcare and helping organizations achieve their goals. So right now I'm the VP of EHR Managed Services, as Clay said, for Optimum Healthcare IT. And really our focus in managed services is our delivery is focused on utilization and capacity management of our team. And I'm very interested in we use in our operations automation and how we function every day and deliver our services. So I'm excited to share some of the experiences that I've had there with you all. All right, so the challenge. So healthcare organizations are constantly asked to do more with less. This isn't new to us. And the necessity to flex and meet rapidly changing industry and market demands is fierce. Employees are one of the biggest line items on any health organization's budget. So today I'm going to focus on some tactical approaches to assess for automation as part of your resource planning strategy and provide insight into how that investment will continue to provide return and can also multiply over time. So like I said, I'll draw from my experience personally in health systems, but also in our planning for staffing our managed services team at Optimum. So how do we solve this capacity challenge in the face of tight budgets and an increasingly challenging labor market? First, I will review our objectives for today. So I just went through the challenge. I'll go through a quick history of healthcare IT, and then I'll jump into understanding automation, and then ultimately how to assess for automation opportunities and determining ROI. All right. So a quick history review. So before we talk about moving forward, it's important to understand how we arrived here. So these stickers and paper charts always bring back memories. It was a line item in every clinical operations budget, right? But those stickers and paper chart line items quickly multiplied in the face of federal requirements to transition to CPOE and ultimately the EHRs we know today. So this long transition required and still requires a lot of investment in time, people, and technology. So if we stop and think about it, over time, as we added technologies to our healthcare systems, those tools required additional people to implement, manage, maintain those systems. So slowly over time, we added all of these resources. So data entry, training, maintenance, support, informatics positions, governance groups, all of these are the result of the addition of the EHR. So what happened next? So we implemented, and then we get to this point of stabilization, right? So as organizations stabilized from implementation, they began optimizing. So the EHR should make things more efficient, right? We should be able to optimize workflows, consolidate, all of these great things. But as a result of this, a huge effort went into process improvement and lean methodologies. I'm sure you all were involved in them at some point, hopefully still involved in some of them now. Many of them saw success, but many efforts fell flat without the right leadership investment or direction across complex processes where true improvement really could be realized. So I'm saying all of this, but how does it tie into automation? Well, 10 plus years ago, automation tools weren't sophisticated enough for deployment in a health system to serve a really valuable place in process redesign, but today they are. I see them as a very valuable tool to consider as part of capacity planning, which can and oftentimes should include process improvement and redesign as well. All right, so understanding automation. So I'm going to go through a couple of these key areas in automation just to make sure our audience has a good understanding of what we're talking about here when I say automation. So automation is utilized regularly in most other industry. And like I said, I think it's really important to consider it as part of your staffing and capacity planning strategy too. When I think about RPA in particular, I think about it as another resource, like a human, that can complete a scheduled, predictable program tasks. It can do it in succession and across multiple systems. Gartner specifically defines RPA as a productivity tool that allows a user to configure one or more scripts, some vendors refer to them as bots, to activate specific keystrokes in an automated fashion. So these keystrokes mimic or emulate tasks or steps within a process. So an early example of RPA that most can relate to is the Excel macro, right? So you're in Microsoft Excel, you click the record button, it records your steps of whatever you're doing in Excel. And then later on, you can run that Excel macro and execute that, and it'll do all the same things you did that you recorded earlier. RPA is just like that. It is that. So some other great use cases for RPA are bulk data movement, exporting and importing from one system to another, or things like manual field entry from a report. So RPA tools perform highly logical tasks that don't require knowledge or human understanding. A healthcare IT example would be something like ticket preparedness. So if every access ticket your team needs to work requires a specific set of data for build, what you can do is configure a bot to run overnight and perform a task on that ticket if the data doesn't exist. So maybe your staff right now, for every access ticket that comes in, they have to go to the NPI website to verify that provider ID number. Not necessarily the best use of your IT team's time, right? Especially if the requests are high in volume. So RPA is appropriate for any type of task that can be easily performed if there are clear conditions associated with carrying it out. So, if this, then that. It's also great for kicking out edge cases. So, that 80-20% rule can generate a report or notify a human when it's hit a snag that it can't logically solve. So if something within a specific task changes, for example, a form field is renamed or a data source changes, the bot has to be reconfigured in order to work properly. So this is important to consider when programming your processes. Think about Epic Text, for example. In the back end of Epic, the menus are named and numbered. The numbers have been known to change over the years of those menus, but the names don't. So you would configure your bot or your process to utilize the menu names for navigation to avoid unnecessary updates in the future. Of course, any sort of good programmer will identify this for you. Jumping to machine learning. So machine learning is a component of AI, artificial intelligence, and is a tool that can be used to amplify RPA. So I said just a little bit earlier that RPA tools do not learn as they go, and in their basic form, they do not. But most RPA tools now have offerings of machine learning built into them in order to take RPA to the next level. So for example, a tier 1 to tier 2 ticket triage is an issue at some organizations. An RPA solution may be to create a bot that sends tickets to tier 2 queues based on a set of logic, right? Like that's really what our tier 1 team is doing as well. However, machine learning built into this tool can take it to the next level by learning from triaging mistakes and including that data in its logic going forward. So all of that summarized, machine learning uses structured and semi-structured historical data to learn and make predictions without being explicitly programmed. Where it falls short of AI, which I'll get into in a minute, is machine learning only works with a predefined knowledge area. So artificial intelligence applies advanced analysis and logic-based techniques, including machine learning, to interpret events, support and automate decisions, and take action. So it's the whole shebang. Otherwise said, it performs human-like tasks. They can intake large quantities of data and on their own build algorithms that help determine the right way to perform a task. It can be in terms of healthcare, it can be, assessing data in a chart to help providers make decisions. Above and beyond that, we're seeing too. In other industry, and especially post-pandemic, we've seen that AI has built popularity through chatbots and virtual assistants, all of those sorts of things. These are two popular ways in which AI is being leveraged in the business world. In the tax world, for example, AI can make tax forecasting more accurate with predictive analysis, perform in-depth data analysis, make it easier to identify deductions, that sort of thing. Flipping that over into healthcare, I think about assessing claims data to take action or identify and report on trends or areas of deficiency in payment or documentation. So AI can be an extremely valuable tool, but it takes a large undertaking to support it, and achieve buy-in, and typically requires a larger cultural shift and greater leadership support. RPA and machine learning, however, tend to be a great gateway into this world. While still not easy to implement by any means, use cases tend to be lower hanging fruit that can prove ROI quickly, and with a number of service organizations out there prepared to help with implementation and support, can be a great way to propel your team into the future and create capacity for higher level functioning within your team, which is what we're here to talk about. All right, so it's important to just understand who some of the big players are in this space. UiPath, Automation Anywhere. Microsoft is in this space now with Power Automate. Cryon and Blue Prism. Pegasystems is another big one. And I'm in no way, shape, or form advocating for any one over the other of these. But what I think is important is understanding how your application is accessed or generally operates is important when evaluating a tool. So Epic, for example, is typically utilized via a Citrix interface. So this means the image of the application is broadcast, right? And the elements are not recognized by traditional object recognition. So whatever tool you choose, if your use case is going to be within Epic, you need to make sure that it has some sort of good solution for replacing that typical object recognition. All of these big players, I think, have that down pat. So assessing for automation. All right, so a couple of key takeaways first. So before I dive into the details, I want to review these four things. First, automation, RPA, machine learning, or AI will not fix all of your problems, right? Just like the vaccine will not fix all of our problems, capacity or otherwise. It's important to understand when and where it is best utilized in order to achieve value and return on investment, as well as successful adoption from the team and others invested in the technology, which is just as important. Secondly, it does take time and investment to complete the appropriate analysis of tasks or processes that are eligible for automation. This isn't, a plug and play type solution. Third, a broken process should not be automated. You're going to waste valuable time and money programming band-aids and workarounds for processes that haven't been addressed from a PI perspective. Sure, you may find a cost comparative win here or there, but for the most part, the process should be corrected first. Otherwise, you're going to have to go back and alter your programming at some point in the future. And then fourth, introducing automation to a team should be positive. Investing in technology that allows the team to elevate their daily work is a win. In some scenarios, it's a great opportunity for retraining and cross-training. And the more you can incorporate the forward thinkers as SMEs into reviewing those processes and market the benefits of taking lower level tasks off of their hands, the better cultural position you will be in. So like any project, identify your champions and they will help you sell to your team. All right. So now that we have a few basic takeaways under our belt, what does it take to assess for automation on the team? So first, we're starting with a capacity problem, right? So we have capacity issues on our team. We have projects or a gap to close. So we need to understand what that gap is and the timeline in which we have to close it. So is there, and in my business line, we do this all the time. So is there a particular amount of hours that we need to close or fill or do for a client? We need to understand what is the skill set needed for those hours or projects. Is it for an extended period of time or is it for a short period of time? So understanding that problem. And then we must compare that need to the resources we have available to us now. So what's important there is really understanding your team, any capacity pockets you have already, and then the skills that your team has, but also the skills that they might be interested in building, right? I said a little bit about cross-training earlier. So once we're there, then we ask the question, okay, if I can't hire to fill this gap, are there tasks that I can automate to create capacity in that area or on that team? So you want to ask yourself or your managers, where does that low-hanging fruit exist? Are there tasks that my team does every day or high volume that they really don't enjoy or just kind of rote, busy work type tasks? All right, so the next step is to educate yourself. So understanding what is possible is key to determining the right processes for these projects, which is kind of why I went through all those different types of automation earlier. But the person who is doing the education doesn't necessarily have to be you as the leader, but someone on your team needs to be a subject matter expert and focused on this. It's crucial in identifying opportunities and ultimately your success. So once you have a sense of what's possible, then it's time to brainstorm pilot projects. So I recommend starting with a few key leaders in your inner circle. As you gain buy-in at that level, you can incorporate your SMEs and forward thinkers that are actually performing the work. So here are some approaches for brainstorming RPA projects that myself and my team have used in the past. So I've been saying this earlier. First, you look for where there might be high volume, low complexity tasks. So there are a couple of places to look here. So one, you want to look in low paying positions. So could this position be repurposed or the person retrained to a different role? A 5-minute task done by 10 people 20 times a day multiplies very quickly. But you also want to look in high paying positions. So is this person always working at top of license? Is it a task across all people in this position? If a high-paying role like a DBA or an application analyst is completing a task once a week that takes 5 hours, it's worth an evaluation to determine whether or not it could benefit from some type of automation. And like I said earlier, look on the teams in which you need capacity, but also on those you don't. Cross-training could be a really great opportunity for certain roles or teams, and also a great retention tool now in the environment that we're in. So once you've identified some ideas, make sure you measure volume. So how much time would this save this employee or this team? Also consider intangibles too, like employee satisfaction. And then measure complexity. So can the process be easily documented in logical form? Sometimes involving a BA, and this process can help with the analysis and documentation. If you're in IT, most analysts are able to do this themselves. But you'd be surprised at how many people think a process is too complex to be automated. But once it's on paper, the complexity of time, space, communication, multiple systems, all of that kind of becomes clear. And the team member may say, oh, you know what? I actually can see how this would work. So finally, for RPA use cases, remember that oftentimes they're hidden in plain sight. So we get used to a person performing a task because we've always seen it performed by a person. But that doesn't mean it has to be this way. My advice is to challenge the norm and even push a little further than people are comfortable with in order to make forward progress to what is truly reasonable, in the moment. Lastly, a couple of thoughts on machine learning projects. So during brainstorming, you may generate some ideas that don't bring as much value unless there's an element of learning and agility to that process. So I would table those for later review, unless you feel comfortable, moving forward and have a great organization you're working with that knows what they're doing there. But after a few RPA projects are completed, you can digest something more complex as an organization. So now that we've discussed the basics of assessing for automation, I think it would be helpful to share some practical examples of where RPA, machine learning, and AI can be utilized in a healthcare IT department. So one of the first things I think of when I hear high volume, right? High volume, low complexity, is healthcare IT is access requests or updates. So access is oftentimes a problem area and a bottleneck for organizations, especially those academic organizations dealing with influxes of a variety of students throughout the year. I've seen organizations automate or partially automate Epic security build updates. So with Epic offering templates and now blueprints, this is an area where organizations can save time and create capacity for other projects or tasks that are necessary for the department. Another area with high potential is monitoring. So with all of the interfaces in and out of our clinical IT systems, monitoring of interfaces, error queues, and other types of notifications are a great area to review to create capacity. Most of the time, the actions taken on an error queue are very logical, if this, then that, with only a few edge cases that truly need human intervention. And remember, bots don't get upset if they have to work overnight. So let's see. So managed services. So we do this, like I said earlier, all the time. We're always assessing for capacity and utilization. That's really our business model, is making sure our team members are utilized to the top of license, leveraged across clients. So the more that we can find these examples to be able to optimize the amount of time that they're spending on a task is beneficial to our business and to our client. Because one thing I haven't touched on a lot in this presentation is the benefit of quality that you get from a bot running a task too. There's a lot of quality reporting and other things that go into it. So once in our business line, so once we identify a process that can be automated, it becomes part of our staffing equation, really. So going forward, as we look at clients or projects that we're going to do, we incorporate, okay, is there going to be some sort of automation as part of this? And it becomes part of that staffing equation. Okay, so ROI for automation. Sorry, I got a little lost here. RPA doesn't necessarily require a large investment to get started, but it is important to understand how it works in order to create the most ROI. Bots run these processes, and it isn't a one-to-one ratio. It's a one-to-many. So one bot costing anywhere from like $5 to $10K annually for licenses can run multiple processes in succession. So if you're using some sort of consulting organization to help you build your programming and provide licenses, you have to factor in all of these build costs into your ROI equation. And typically there's professional fees and all of those other things as part of the build process. But typically this all comes out at less than the cost of an FTE. So with that in mind, if you can create some standard automated processes with slight variations in programming, the incremental cost to change those processes can be minimal. So for example, if you program a bot to monitor one error queue within Epic Hyperspace, you can leverage a lot of that initial navigation build to monitor a different queue with slightly different logic. So the more processes you can add to a bot, the more return you'll see. So that 1-to-many ratio. Ultimately, your ROI will be calculated based on the hours you're saving to be redeployed elsewhere. And measuring volume and time multiplied by labor cost will get you started to determine the amount of time and cost spent on a task, which can lead you to a cost comparison. So I've said this a few different ways throughout this presentation, but automation provides you an opportunity to create incremental capacity. So in most healthcare IT organizations, it's hard to hire affordable part-time work. Automating lower level tasks creates incremental capacity for your more valuable resources to spend time on the complex and interesting work. All right, so getting started. So there are lots of tools and vendors available. You want to start with a functional area that needs to create more capacity. And I recommend outsourcing your kickoff to ensure the right focus and build. Full disclosure, Optimum does not do this, so it's not me selling this service to you. But I think another key element is determining your internal versus your external strategy for go-forward support and implementation. It's an important early decision. So are you going to continue to have an external firm supporting you in building your processes and maintaining your systems and monitoring? Or are you going to eventually bring that in-house? All depends on the size of your organization and really the vision and where you want to go with automation in general. All right. So in closing, healthcare organizations must get more creative in utilizing their existing talent in a maximized way, which should not include robotic, repetitive tasks. Through taking the time to assess for these types of activities within your teams, you can create capacity and show that you're invested in elevating your employees and their contributions to the organization. So thank you all very much for your time. I have my email on here if you'd like to send me any questions, and we'll review any questions in the chat afterwards. So thank you very much.
Thank you, Kristi. We appreciate your presentation. You gave us a lot to think about. What I'd like to do right now, I don't see any questions in the chat for you, so you've obviously answered everybody's questions. And then when everybody signs off, they'll send you 1 million of them.
That's how it goes.
I'd like to introduce our next speaker right now. Mr. Lucas Smith is the Director of Ambulatory Services and Property Management at Summa Health, and he's going to talk with us about healthcare capacity management with technology from the ambulatory care perspective. Lucas, I'll turn the stage over to you.
Thank you so much. Can you hear me okay?
Yes, I can.
Okay, good. So everybody can hear me. You can see my presentation?
Yes.
Perfect. Well, thanks, Christine, so much for the introduction, and I appreciate the opportunity to get to talk to the group today. My background is in the ambulatory setting, so I do a lot with strategic growth and then also operations of our ambulatory facilities. So capacity is, it's huge. It's something we're always looking at. It's looking at, again, the capacity for patients in the existing space and the capacity for the providers, all the way around. So I'm looking forward to the opportunity to kind of talk to you for a few, and the talks so far have been great, and I'm gaining a lot of wonderful information from this so far. So thanks to all the previous speakers, and looking forward to ones coming up here in the future. So let me see here. There we go. So a couple things that I'll talk through in my talk is basically just what is capacity management to me and why I see it's important in my role and in the kind of in the ambulatory world for healthcare. Key areas that we can look at capacity in the ambulatory setting, what gains can we make by improving capacity, and how we can leverage technology to manage capacity. And then lastly, just some initial considerations that I've found are helpful as other health systems or other departments look to leverage some of this technology or implement some new programs. So what is capacity management? To me, in keeping it simple, it is managing the patient load and the allocation of resources for those patients. And when we say resources, again, that's the physical environment, it's the providers, it's your clinical staff, it's the non-clinical staff, it's financial resources all the way around. So again, how can we manage that capacity and patient load with technology is what we'll talk about today. There are a lot of risks of poor capacity management on a health system. One, when capacity is overloaded, there's significant risk of losing business. We can lose quality of care. We can lose patient satisfaction levels. And there's also a high level of staff burnout when there's increased capacity or we're not able to effectively manage that capacity. And then on the flip side of that, if there's low capacity and too much downtime, we obviously suffer from operational inefficiencies and the system can struggle. So effectively managing capacity is a win-win all the way across the board. It increases the financial strength of the organization and at the same time improves satisfaction and outcome for our patients. So again, all the way around, it doesn't get much better than that. Improve patient outcomes, improve patient experience, improve operations of the system. There's not too many things that we can implement and work on that, we don't find a, flip side or a struggle somewhere else. And these are no-brainers. So what are some areas that we can effectively manage capacity in the ambulatory setting? Again, we can improve utilization of our physical space. We can improve provider capacity, so how many patients our providers can see in a given amount of time. Improve building design and efficiencies. When we're working with our architects and designers, when we look at building buildings, when we can look at using technology to help manage capacity, we can make a lot of efficiencies in the building design itself. Decrease unnecessary emergency and urgent care visits. This is a big thing. There's a lot of unnecessary ED visits that we have to see, which causes increased wait times on other patients and again, burnout for providers. So if any of those that we can help offload, the better. Reduce readmissions into the hospital utilizing technology and telehealth. We can extend specialty care to those in rural areas or folks that can't get in or just need to be reached easier. And then lastly, and obvious is improve a pandemic response, which we were able to see with COVID. It was mentioned earlier, and it's true. I mean, the pandemic basically jump-started telehealth and got it to where it would have taken every bit of 10 years to get to. Some of the biggest hurdles to telehealth were some of the regulations and things of that nature, which were opened up and gave us a lot of leeway and flexibility moving forward with telehealth. And I think a lot of that's here to stay. I think providers that were skeptical have seen the value in this, patients have seen the value in it, and organizations have seen the value of it. And because of that, I think our legislators and payers are going to see the value in it as well. And it's just it's going to be here to stay. It's not going away. So I'm going to give some examples of some ways we can leverage technology, some things that we've done here at Summa Health, and then also things that we've looked at. But these are all ways that we've found that we can help manage capacity in our health system, in our ambulatory centers, utilizing technology. So the first one is, a virtual waiting room. So this is something that you see done. I mean, this is done everywhere. It was done at a vet's office. It's done at stores. It's a way to utilize technology to check in for an appointment, or basically let any office, any physical space know that you've arrived or you're there for your appointment from your vehicle, or from some common waiting area if you don't want it to be in a vehicle. The way this has worked is, the way we've used this from a vehicle, so patients can pull in, log in, indicate that they've arrived for their appointment, and then that provides an alert then to the office. The office then sees that the patient has arrived and they're on site and they're ready for their appointment, and then they can send an automated alert back to the patient when they're ready for them, or give any specific instructions. Which this is kind of nice, because there's just a multitude of different possibilities here. You can give patients, virtual maps, directions on how to get where they're going. Any pre-appointment information can be sent back on these alerts, which again just saves time and effort, and it's more comfortable for patients. They can do this from the comfort of their own vehicle, or they're listening to the radio or whatever. We've also used this opportunity to market, right? If there's something, any kind of marketing information we want to share with the patient, it gives you an opportunity to throw something out there to the patient, or maybe just some patient education stuff that you can kind of get in front of them before their appointment, which is kind of nice. So what does this do to the physical space? This is obviously creating a lot less need for waiting rooms. You won't have any overcrowding. You don't have people on top of each other. When we design new buildings or even renovate space, what we've found is we can cut the size of our waiting rooms into a half or even a third, because now we don't have patients, again, standing around in the waiting rooms waiting to be seen. We've created more efficient processes. So when we call them in, they come to the window, check in, and we send them back to the exam room. This also, again, this was fast-tracked because of the pandemic. But again, if we have another one, or still trying to socially distance in our waiting rooms now, with using a virtual waiting room, we're able to socially distance easily and create a better experience for everybody all the way around, which again improves patient satisfaction and increases our scores. So take that a step further too, as opposed to just having a virtual waiting room, why don't we leverage technology to allow the patients to digitally check in, do their registration information and paperwork, either from their car or from home before they come, or even a kiosk in the waiting room. So this is, just like in an airport, you can come in and use the kiosk system to check in for your flight, put in your information, and print your boarding pass. Well, this is, to me, this is a win all the way around, an easy solution for a medical office. Why not use a kiosk? Again, you cut down on the load on your staff that have to see these patients. You cut down on wait times, and you can fit 4 kiosks in the space of 2 traditional registration booths. Patients can perform all of the registration processes either from a kiosk, or again from the comfort of your home. Do it the day before your appointment, do it the morning of, do it in your car while you're waiting to come in. Input your demographic information. You can take pictures of your insurance cards front and back, your photo IDs, pay your co-pays. Then this is all done before they even come into the exam room or come into the office for that reason alone. So again, this makes more efficient use of physical space. It cuts down on the load on your registration staff, and just creates more efficiencies all the way around. So again, and I kind of talked through some of this, decreased demand on support staff, less registration booths when designing space, which either decreases the footprint of the overall building, which is going to decrease your cost, or allow for more clinical space, which is always needed. Streamlines the process, and again, going back to all of these things, improve a pandemic response, which if we already have them in place, it's something we don't have to try to quickly implement in the face of another pandemic. So a third way to leverage technology to decrease or to effectively manage capacity is a direct-to-consumer or on-demand telehealth visit. So this allows patients to request a on-demand visit from a provider for a certain medical need. And what I mean when I say on-demand is basically like a urgent care type of visit. So nothing that's scheduled with your primary care provider in this instance. This is basically an online urgent care. And there's a number of ways you can access these type of visits. I think most people are familiar with the traditional type of video visit that they see from a provider. These visits are great. They provide that, you can see the provider. It's that face-to-face, kind of without being truly face-to-face opportunity to talk through a condition and get a diagnosis, a plan of care, and everything you need from a prescription moving forward. Other ways are chat. There's chat functionality where there's no video needed. It's just basically like a chat text back and forth between a patient and a provider. Or there's asynchronous visits, which we have found to be very successful and highly utilized and liked by both the providers and the patients. So these asynchronous visits they have some logic built into them. Patients go through and answer questionnaires based on a selected condition. And then based on the way they answer those visits, providers have the opportunity to ask any additional questions if needed, or based on the information that has been collected, provide a diagnosis, plan of care, prescription for the patient. So these are huge. What we find for a lot of these are the acute general medical conditions. So the highest use cases are upper respiratory type of symptoms, infections. Prior to COVID, it was the sinus infections, the UTIs, general skin conditions, and pink eye is highly, highly used. And these are a lot of things that people would otherwise have gone to emergency departments or urgent care for that don't need to. And some other big use cases are dermatology. So dermatologists, it's easy to take a picture of a rash or a condition and share it with a dermatologist via an asynchronous platform, or let them see it through a video platform, and they're able to properly and effectively diagnose these conditions and provide a plan of care and any prescriptions if needed. And behavioral health is another big one. I mean, that one and dermatology both. I mean, the demand for these services is so great that, most areas don't have the providers to field the demand, and the wait times are astronomically long to get in for an appointment. And now this helps alleviate that, because you can get these visits either on demand or with a short wait, less than 3 days is what we've found. So again, what does this do? It increases the overall capacity to provide care for the organization. We can touch many more lives and many more patients by offering these on-demand telehealth visits. Whether patients don't have the means to travel to a location, or they don't have the financial, a copay for an ED is much higher than your cost for a telehealth visit. It decreases unnecessary emergency and urgent care visits. This allows us to see these patients, and it also increases capacity for the more severe and necessary ED patients and urgent care type of patients. This improves office time slots and provider availability. So some of those patients that would have otherwise made an appointment for a sinus infection with their primary care provider, now that primary care provider is able to have more capacity to see some of the needed visits in the office, and some of these other ones they can take care of in a couple minutes time. The asynchronous visits take a provider on average 2.5 minutes to see that patient and answer that visit. So that's a huge increase in capacity for them. And again, like I mentioned earlier, it increases access for hard to get in services like dermatology and behavioral health, so on and so forth. And we've found a huge improvement in patient satisfaction by offering these visits. We've seen an increase in patient acquisition. These are open to anybody. So maybe this is your first experience with an organization. If you create a great experience and something that provides a great solution for patients, it gives them a reason to want to come back and continue to utilize your organization. And again, it allows for flexibility during the pandemic. Just to give an example, we were able to provide a new diagnosis, or a new condition rather, and diagnosis for COVID, and it offered the opportunity to offer free visits for any upper respiratory type of condition during the pandemic. And what this did was kept people home. You know, if you're sick, the last thing we wanted you to do is come into the primary care office, go into an urgent care or emergency department unnecessarily. So by offering free visits via telehealth, we were able to see these patients, keep them isolated from other patients, keep our community safer, keep our providers safer, and also provide care for exponentially more patients than we otherwise would have. So again, it's that win-win situation all the way around. So, and then another way is schedule telehealth visits with an existing provider. So the difference between that and on-demand is these are, you know, scheduled visits with your current primary care provider or with specialty providers that you need to see. And this can be done with any appropriate patient across the board. Like I said, these are surgical follow-ups, post-inpatient stay follow-up with an infectious disease provider, just doing your normal routine follow-up with your primary care doctor. And these can all be done the same way. They can be done via video, chat, asynchronous. What we found is the most common for this one, though, is video, just because there's a more diverse range of things that you would be seen for with this. So video tends to lend itself better to these type of scheduled visits. And the flexibility it provides and the increased capacity is very, very good. Our providers are more productive. This increases the productivity of exam rooms. So to give you an example, when we design space, most providers on average request 3 exam rooms per provider. So what they usually look at is they've got one exam room with a patient being prepped by an MA. They've got one exam room where the physician is in the room with the patient, and another exam room that's currently being cleaned. So this makes for a very efficient process from a throughput perspective, I guess, but it's very inefficient because now you always have, you know, a third of your exam rooms are sitting empty with nobody in them. And when space is at a premium and the price of real estate's going through the roof and there's just not physical space out there, if we can decrease that to 2 rooms per provider, because they can take that third room and turn that into a virtual room, and they can step into a small, either their office, or we've created some spaces now with small telehealth rooms, which are set up just to do telehealth appointments, and work those into their schedule. Now those visits are done in a fraction of the time an in-person visit's done. So you're creating, you know, you're seeing more patients in a day, plus we've decreased the physical footprint needed to see more patients. These are also good for post-inpatient follow-up. It's been shown to decrease readmissions. So there's a lot of times that patients go home, they're home for a couple of days, they might start to get worried about something or fearful and just need to talk to somebody, and otherwise they come back to the ED and then possibly get readmitted and then have to see the provider, where if they could do a follow-up with a physician or a physician extender, ask those questions, be able to, you know, send some data over to that provider, then that provider can make the call that, yeah, you do need to come back in, we need to see you, or, you know, things are looking good, you're fine. Maybe let's get you seen by your primary care provider or see me in the office the next day or two, but there's no reason to come back into the hospital. Again, this increases capacity for specialty care providers. Let's look at a total knee, for example. Total knee patients, you know, these patients are done as a lot of, you know, we can do outpatient total knees now, but it's nice to have a follow-up in the next day or two to see how the incision's doing, make sure that the patient's feeling good, do a quick checkup on their range of motion. That's all done through a video visit. We save these patients who are there at home, they're sore, they just got through surgery 2 days ago. The last thing they want to do is get in a car and drive into an office just for someone to look at the incision, see what their motion's doing, tell them you're doing great, keep it up, we'll see you next week. We can do these over a telehealth visit. Which again, this is a way to this increases patient satisfaction. It's continuing to increase the quality of care that we're able to provide. So, you know, these are just some examples. So those 4 examples. So how do we implement it? How do we get started? So there's a number of ways you can get the needed technology you have, and they all have kind of their pros and cons. So these are all things that, you know, can be considered. One, do you build the system yourself? Do you not use a vendor and build your own? So to do this though, you're going to have a pretty robust team with a lot of experience. From what I found, this is going to take a lot of time and a lot of money, but by doing it this way, you get a lot of money up front, but then you get exactly what you want. you can build it to your exact specs, to your exact needs and wants, and it's yours. But again, there's a lot that goes into that. Another thing is to partner with a vendor that can provide kind of a white box solution with customizations of an already established solution. So they kind of provide the bones for you, and then you can brand it. This seems to be probably the most popular, right? So you can brand it with your own brand. You've got some flexibility in how the program works, how it's delivered, the different modalities that you would want to provide. This is a moderate time to implement, but not too bad, and kind of a moderate cost. You'll usually find that there's a yearly licensing fee and things of that nature. And it's still going to require help from IT and whatever customizations you might want, integrations with your existing medical record, things of that nature. But again, this seems to be kind of the most common. It allows you a lot of flexibility without having to build the actual program yourself from scratch. And a lot of times what you'll find is with programs like this as well, as opposed to like a homegrown program, is you have the opportunity to use additional providers if needed. If you don't have the on-staff providers to cover telehealth, a lot of these, vendors will have the opportunity for a physician network to help as well with some of these patients, obviously at a cost. And then the other one is, some places just say, hey, I'm just going to subcontract this out to a vendor with an off-the-shelf product, and the vendor will provide the service for you. So some health systems might find that this is just something that they don't want to get into, but they realize there is a need for, especially the on-demand telehealth visits. They can offer kind of a licensed product that another vendor just offers that service for the organization. So this will have the least amount of customization, if any, super fast and easy to implement, and it really doesn't take much, if any, support to operationalize. But again, the revenues for this are going to go back to that vendor, and if you're promoting somebody to provide this service on your behalf, there's risk there, because if they're not providing the care that you would expect and that your patients expect from you, that's going to be a reflection right back on you, because again, they're representing you and what they're providing. So there is definitely some risk there. So what are some of the next steps? What I would say is go back and look at where you see opportunities to improve capacity in your own system. Where you see those opportunities, look at how you can leverage technology to help address those opportunities. And again, using the examples I gave or the many others. I mean, if you do some research, there are so many opportunities to improve your capacity management utilizing technology, and don't be afraid to think out of the box. Things are flexible, people are flexible, and if you can think it, there's probably someone out there that can help you do it. Thank you very much.
Thank you, Lucas. I don't see any questions. If the audience has any questions, we have a few minutes before our next break. Just type them into the chat box, and we will pass them on to Lucas. I think everyone's very shy. I don't see any questions coming through. So what I'd like to do right now is invite you to some more time either networking or visiting the expo, possibly getting some lunch if you would